Let's talk a little bit about the oxyhemoglobin dissociation curve. Hi, I'm Amanda. I'm a neonatal clinical nurse specialist, and I want to help you become a certified NICU nurse. Now, the oxyhemoglobin dissociation curve gives us an idea about the relationship between oxygen that's bound to hemoglobin, what we see as our pulse ox, and oxygen that's dissolved into the arterial blood, or the partial pressure of oxygen in the arterial. As we know, oxygen binds to hemoglobin, and hemoglobin carries oxygen to the tissues and the organs to release it to feed those tissues and organs oxygen so that normal metabolism can occur. But have you ever wondered what really drives how that hemoglobin decides to release the oxygen? There's a few factors that affect the affinity for hemoglobin to oxygen, or how tightly hemoglobin holds on to oxygen. Some of the things that will decrease the affinity hemoglobin has for oxygen, or make it easily release that oxygen to the tissue, it easily lets go, include whether there's hemoglobin A, or adult hemoglobin, as opposed to fetal hemoglobin, when there's increased temperature, when there is increased CO2, or when there's decreased pH. On the opposite end, there can also be an increased affinity for oxygen with the hemoglobin. So when we have fetal hemoglobin, when we have hypothermia or decreased temperature, when we have really low CO2 or high pH, then hemoglobin has an increased affinity for oxygen. It does not want to let go. When hemoglobin has a decrease in affinity, that is when we see what's called a shift to the right on our oxyhemoglobin dissociation curve. What that means is basically the shift to the right will result in a higher partial pressure of oxygen in the arterial blood for any given saturation. Other end, if there is an increased affinity for oxygen, hemoglobin is going to hold on to the oxygen. So there's going to be a lower partial pressure of oxygen in the arterial blood for that given saturation. I don't know about you guys, but the first couple of times that I heard this shift to the right, shift to the left, I kind of was lost. Like, what does that really mean? Let's put it in more of a clinical context. Let's say you're taking care of a baby and they're under the radiant warmer and their temperature probe fell off. And so they got a little bit hot. What might you see? So when we have an increased temperature, we have hemoglobin will have a decreased affinity for oxygen, meaning that the hemoglobin will readily release the oxygen off of it. Maybe too readily, maybe too easily. And so what might you see at the bedside? That baby might be desatting. Their saturations might be very low because the oxygen is offloading too easily. Now you might increase the FiO2 and not see much of a change because your baby is hot. And you see that shift to the right on the oxyhemoglobin dissociation curve because of that decreased affinity for oxygen. Now, the way that you would actually improve that baby's SAT is by improving their temperature, not necessarily increasing their FiO2. Likewise, if you had a baby who was cold, you might see that their SATs might be okay, but when you look at them, they're cold. They don't look well. And so now the hemoglobin has an increased affinity for the oxygen and it's not readily releasing the oxygen to the tissues. Similarly, you might see the normal SAT, but your baby doesn't look well. Again, you have to improve that baby's temperature to get that more normalized hemoglobin's affinity for oxygen. I hope that helps. Let me know any questions you guys have in the comments below.